we would like for you to share with your audiences our update that we have 2 individuals who have died of influenza, and this is a real reminder to get your flu vaccine. So it is not too early to get your flu vaccine. We really encourage everyone to do so. And as a reminder, for a number of years now, the Centers for Disease Control has been recommending flu vaccine for everyone 6 months of age and older. So we encourage everyone to get their flu vaccine, bring their family and friends along, and get your flu vaccine. It's really, really, really important to prevent the flu.
We're just getting this. What can you tell us about the individual?
Right. So in California, when someone below the age of 65 dies of influenza, it's a reportable event to the local health department. So we are reporting today an adult who died of influenza and a child who died of influenza. From what we know, the adult would have gotten the infection here in Santa Clara County. They had underlying chronic illness that would have put them at increased risk. The child most likely acquired influenza while traveling abroad, and then got sick and died once returning to the county. These are the first flu deaths of the year in Santa Clara County.
When does flu season start?
So flu season doesn't really obey a calendar. What we can say about flu season is that it's always unpredictable. So I think that since we've had 2 flu deaths, we can certainly say that flu is here.
Would you characterize this as early?
This is earlier than we usually have deaths reported, and usually we have other indicators of flu activity prior to seeing flu deaths reported. We have not seen any other indicators of an uptick in flu activity yet, although we have been looking.
Clarify, the 2 were not related.
Correct.
And can you describe some of those factors of show an uptick in flu activity?
So we have a number of ways that we conduct what we call influenza surveillance, or looking for evidence that influenza is circulating. One is we have a system that looks at chief complaints in emergency departments. So when does someone come to the emergency department with a flu-like illness? And we've not seen any uptick there. In addition, the California Department of Public Health has a very robust influenza surveillance system, relies on a lot of data from healthcare systems, and they're not seeing any increase in activity in Northern California above the usual. So another important point that I want to emphasize is that while we generally see flu activity here in our county and in California and in the country in the fall and winter, in other places of the world, flu is circulating all year round or circulating kind of the opposite pattern. So it's really important for people who are traveling to get a flu vaccine prior to travel. And that's really highlighted by the child that died in our county after international travel. We do not know the vaccination status of either case.
We know that, but can you talk about the history of flu strain?
So we don't know. The way that typing of the influenza virus works, when someone is ill, severely ill from the flu or dies, we collect a specimen and send it up through our public health laboratory network so they can tell us what kind of flu. It's too early in the season to say what's circulating or the exact strain that was involved in these 2 deaths.
So it would follow that it would be too early to turn out. Usually we remember how this year's the shot is about 60%.
Right. Yeah.
Too early for that too.
Correct. Too early to say. Yeah.
Does this indicate anything about the severity of the potential of the flu season ahead?
We don't know whether what we know is that we don't usually see flu deaths in September. Today we're reporting 2 flu deaths. Whether this indicates an early season, we don't know. As I mentioned, the other indicators that give us like a little bit of a sense of the tempo and severity of the flu season aren't showing increase in flu activity, not yet.
Are the early flu deaths alarming to you?
What we can say about flu is that the only thing that we can predict is that it's unpredictable.
Both of these individuals Santa Clara County residents?
Yes, both.
How recently were those? Give us
Both of these were deaths occurred in Santa Clara County residents, and I don't have the dates.
They were in the
They were recent. Yes, which is why we're reporting them now.
Both
Yeah,
were in the county when they passed away?
I believe so.
And finally, do you know about the supply of the flu vaccine? I know it's recently available, but do you know about the supply of it?
Right. So flu vaccine is now available. I think you can find flu vaccine in most physician offices, most pharmacies. The county pharmacies within the health and hospital system have flu vaccine and it's available, as well as I think CVS, Walgreens. The good news is that flu vaccine is now widely available, and that's good since we're recommending it for everyone 6 months and older.
How long does it take to take effect?
The flu vaccine, with many vaccines, you generally want to give yourself at least 2 weeks to ensure that it's fully effective. But the main message that I want to give is it's not too early to get vaccinated. It's a good idea to protect yourself now.
What would you say to parents who are concerned hearing an otherwise healthy child died from the flu? It was overseas. What would you say to parents?
I think influenza is one of those viruses that can cause very severe illness and even death, even in healthy children and healthy adults. And we need to have great respect for this virus and do everything we can to prevent it. In addition to annual vaccinations, which we highly recommend for everyone, there are other ways to prevent the flu, and those include really basic things like washing your hands as often as possible, staying away from people that are sick, and it's also really important if you are ill to do what you can do not to spread your infection, and that includes stay home from work, stay home from school, stay home from social gatherings while you're ill.
Regarding the adult who was infected here,
Yes.
so presumably was infected by someone else who was
Right.
ill.
So influenza generally spreads person to person. So when you see someone who's ill with influenza, in general, they got their infection from somebody else.
You
But there
mentioned
was
it's never too early, but there's this popular belief, a lot of people with kind of impression, mistaken belief, I guess, that it's too early to get a shot. Can you talk about that?
It's not too early to get your influenza shot. So we recommend the influenza vaccine for everyone 6 months and older, for anyone who's doing international travel, and for anyone who's in the county. Go ahead and get your flu shot. It'll protect you from now till the end of flu season.
Because I think what Mike might be alluding to, some people are concerned of getting it early, that it won't last, for sometimes this flu lasts longer into the spring.
Right. I think it's okay. We recommend that everyone mobilize and get your flu shot.
I know you're limited on what you can say, but what can you tell us about the people who passed away?
I can tell you that one adult passed away. This adult had an underlying chronic illness that put them at increased risk for severe flu. And I can tell you that the child was otherwise healthy and most likely became infected while traveling overseas.
Can you say where the child was?
I don't have those details.
What county facilities offer flu shots?
So the county health and hospital system offers flu vaccine at the pharmacies. So you can walk in and get a flu vaccine at any one of the county health and hospital system pharmacies, as well as I believe it should be available in the county clinics. And Britt can probably give you more details, and we can send that as well if you need the details.
Can you say when you typically see your first flu shot, and when is the peak?
So the flu season in general, it can peak as early as late November, or sometimes it doesn't peak until late March. It really varies. Last year, I don't recall when we had the first deaths, but I think that over the whole season we had 8 deaths reported in people under 65.
And usually you see evidence of infection before you see death.
Right. Usually we see other indicators of influenza activity before we have a death reported. We also get reports of severe influenza, so that would mean people who require care in an intensive, are hospitalized in intensive care. Usually we see those reports before we get a report of a death. So this is unusual in that we're reporting a death prior to other activity.
You know, most people don't think flu is all that dangerous. You don't think that you're going to die from flu. But it is, I guess, what you're saying, it is dangerous.
Yep, flu kills tens of thousands of people every year in the United States, and I think that these 2 deaths in our county really highlight that point and highlight the importance of prevention. It is so simple to get a flu shot. It takes just a moment, and in many places, flu shots are free of charge. So we've collectively tried to do everything we can to remove barriers and make it easy to get a flu shot.
In general, what are the statistics showing in terms of the deaths from the flu and those who have been vaccinated against it?
So for this season, we really don't have much data yet because it's early on.
But in the past, like you mentioned last year, there were 8 deaths, or just historically, do you have any information of typically the deaths from the flu related to people if they had the vaccine or not?
I don't have like really crisp data to give you off the top of my head, and I do want to highlight that it varies every year, the effectiveness of the vaccine and how well the vaccine is matched to the strains. We don't know yet, of course. We haven't confirmed which strains are circulating because it's awfully early.
Can you give us a ballpark age of the child, like under 10 or under 6?
So it's a child under 18.
What's the likelihood that this child might have created a hotspot infection from the doctor?
I think I don't know. I think what's important to note is that 2 things. One is that flu is circulating internationally, so pretty much any time of the year you can find a place in the globe where you can get flu. So if you're going to travel internationally, you want to ask about a vaccine. And the other is the fact that an adult has died in the county of the flu indicates that flu's here. It's circulating. We need to protect ourselves. And we need a new building for the health department.
Do we keep any data on flu vaccine rates or how many people receive the flu shot? I imagine it's hard to get
Right. So there's no like centralized reporting of flu shots and vaccination rates. We would generally rely on national data and then extrapolate to our population about the prevalence of people getting flu shots. Of course, it's important for healthcare providers to get their flu shots. Really, anyone who works with people who are particularly vulnerable, teachers, childcare workers, healthcare workers, super important that they are protected to protect themselves and the people that they work with.
So our flu strain is the same worldwide. I mean, if you get a flu shot here, would it be effective even to China?
Right. So flu is a fascinating virus. It comes in many different flavors. The 2 big camps are influenza A and influenza B. The vaccine covers the most likely influenza A and B strains to be circulating. Then within the influenza A bucket, there are many different subtypes and then subtypes of those subtypes. It's a fascinating virus. And it mutates. It's called drift, which are little mutations that happen over time, and shift, which is a major change, antigenic drift and shift. The public health community does its best in guessing which strains are going to be circulating, getting a vaccine that's going to be the best match, and then we monitor it all season to see how well it worked.
Are you able to figure out the strain after these deaths, or how long does it take?
It takes a while. So our job in local public health is to make sure that we get those flu specimens. Really important to know, to really get a good characterization of the virus. We do that in collaboration with the Public Health Laboratory Network. And it will be a while before we have that information. At least, yeah.
Dr. Cody, can you give us a bit of context? This press release talks a bit about the last flu season. Was that particularly severe? Or what happened? How the last couple of flu seasons been?
Every flu season is different. Last flu season was not a particularly severe season, as I recall. Okay, great. Thank you so much. We really appreciate you all coming out.